Imagine a life filled with shadow. In our world, cataract surgery is routine and often covered by medical insurance. But for hundreds of thousands of the poor in Ethiopia, cataracts are a life sentence to darkness. Imagine, for just $50, you can help give one of these dear people the gift of sight. Dr. James Guzek leads a North American team of volunteers to work beside local surgeons and clinic workers each year to perform hundreds of cataract surgeries in rural Ethiopia.
I have been providing translation and counseling to some of the patients we see here. Their need is more than we can provide. We have little time, little resources. It's overwhelming and heartbreaking. I wish we could do some more.
Hundreds of the blind wait anxiously outside the clinic with their families each day of the camp, hoping for a chance to have their vision restored. All are screened by optometrists to determine if they're a good candidate for cataract surgery. Hundreds more are offered prescriptions for glasses or treated for other afflictions, many caused by trauma. The clinic is always in desperate need of supplies. Here the team is sorting suitcases full of surgical instruments, gloves, medications, and syringes to be donated to the clinic.
The biggest challenge is that a lot of people need prescription glasses for good distance vision or bifocals, and we have no way of delivering that here right now. But that's one of the things that's being talked about, is a good way to refract these people and then a good way to provide prescription glasses for them. Whether we bring used glasses over to give to them or possibly work on setting up an optical lab here or some nearby city.
Cataract patients waiting outside the operating room are given bread and tea to help them keep their strength. The long trip to the eye clinic from outlying areas is expensive, and many have walked here from many miles away and have not eaten since they left home. Inside the operating room, the surgeons must work in challenging conditions. Aware of the crowds outside and the need, it's a hectic week as the team works to serve as many patients as possible. Patients are led inside to an unfamiliar environment, unable to see. Many are elderly and struggle to get up on the beds. The surgeons pull double duty, performing the preoperative local anesthetic to the eyes before attending to their next patient.
I think we have maybe the top ophthalmic surgeon working for us, the top ophthalmic surgeon in Ethiopia, Dr. Bora. He's a superb surgeon, high volume, and really committed to serve the poor, doing maybe about 2,500 cataract surgeries a year under difficult circumstances with outstanding results. And we need at this point the YAG laser to be able to help some of these people to develop after cataracts. It'd be nice to have a vehicle. There are some equipment needs that we have. We need more eye nurses. We need 3 or 4 eye nurses here but it takes time to train people and to get them up and running.
Planning to learn ophthalmic nurse.
How much have you done already?
I've done clinical nurse, and I'm going to learn this year, clinic ophthalmic nurse.
And you'll be able to help a lot of people. Will you be able to stay in Dembidollo or places like this, or are you going to have to move? What do you think?
I would like to serve our patient, our people.
The electricity is unreliable, often going out during surgery. The surgeons must wait for the generator to switch over to continue their work. Meanwhile, next door, instruments are being sterilized for the surgery.
Can you tell me a bit about what your role is here today, what you're doing?
To sterilize instruments for the operating theater and to be as fast, efficient, and productive as possible.
One of the things we could use is probably a little bit of help with Sister Evelyn in some money. She's pretty good with the money, and I think it's probably cheaper to actually buy the equipment here than it is to try to send it over and get it through customs.
Cataracts can affect both the elderly and the very young. Several young patients received surgery during this camp, and parents were allowed to sit with their child during the operation to ease their anxiety.
You can hardly see the wound.
Each morning, the doctors perform post-operative rounds in a darkened tent, carefully removing the bandages and checking their eyes for signs of infection. The incidents of infection are very low, and the doctors are pleased with the results.
Good, and especially the lady that was so severely blind for many years. She just had one chance with that eye, and it's turned out really well. She's counting fingers easily in the dark.
Yeah, she said thank you because she was really having terrible time the last 7 years. And her brother and her child were helping her.
For these people, especially when they cannot see, they can't see to go get water, they cannot work to support their family, and there's a general attitude of hopelessness that they carry about them. And so when we're able to perform this 10-minute surgery, it gives them hope and it gives them a future.
My biggest thrill was picking up the guy out of the wheelchair and getting him on the bench and out again. So we had the chance to do that twice, and now he has 2 new eyes, so that was fun.
We've seen a lot of eye injuries, and some of those injuries have a cataract. Some can be worked on and some can't. If there's glaucoma or other issues, sometimes it doesn't do any good to remove the cataract. And they don't want to do the surgery on anybody that potentially could make it worse.
So you've probably had some difficult moments here then.
Yes, very trying. Some make you real sad, some make you real happy.
So when we do cataract surgery, this patient gets the back side and he's really happy. Next day they start to participate in social events, do productive work, and a child will go back to school.
And we have seen already 168 patients today, and we're hoping to do 50 more cataract surgeries. It's been a really amazing experience, but as you can see, this is really difficult conditions to work in, so we need some help from you, and we hope that you'll give generously and help us maintain this operation and make it better and better so that more lives can be touched. Thank you.